I'm going to give you a little of the details about what's been going on since SICO, a little bit of detail you didn't see in SICO. As you may know, my husband and I were representative of a large number of Americans. I often tell people I've now spoken in 39 states in the District of Columbia about healthcare reform. And I tell people the reason that we were featured in SICO is not because we were so unique, because our story was so different. We were featured in SICO because we were not unique, because our story represented so many American stories. 250 million of us carry insurance, private health insurance. We certainly have been in that group the entire time we've been married, which will now be 33 years, coming up in June. And we've always carried health insurance. And at the time of our worst financial collapse, I also carried Aflac disability insurance, and I had a healthcare savings account at the same time. So, lest we think those things will solve the healthcare crisis in this nation, I can promise you, from my perspective, they did not. And let me tell you part of the reason why. Many of you probably fall in that big group that I fall in, the middle class in this country. At least I did for a good portion of my life. I no longer own a home. I may never own a home again. I'm not sure my credit will ever be repaired to that point. But we carried health insurance, and in the 1990s, we saw this drift. Very gradually at first, premiums would get a little higher every year when the benefits plans were announced. And the coverage would start shrinking a little bit. Co-pays a little higher, deductibles a little higher, fewer doctors we could see. And we did what a lot of middle-class families do. We'd take a look at what Larry's employer offered, and we'd look at what my employer offered, and then we'd try and decide what worked best for our family, what made the most financial sense for our family. And then we would supplement that when we felt we had to with some other coverage offering from our employer. So you're not looking at the slacker class here, or people who were trying to game the system in any way. In fact, we were trying to do everything we could do to be responsible. My husband is a tall, slender guy. He's always been very athletic, but his family has a terrible gene pool for artery disease. He's got peripheral artery disease, which is artery disease, for those of you who aren't medical, in your limbs and in your arteries a long way from your heart. He's also got coronary artery disease. He had his first heart attack when he was 46 years old and began having chronic troubles and began having chronic surgeries and things to control his health. He was no longer able to be a machinist, so he started working other jobs. Then, unfortunately, I was diagnosed with uterine cancer. So we had this kind of double whammy hit the family, where we had, insurance premiums that were drifting and insurance coverage that was drifting, and then health crisis happening at the same time. Within a very short amount of time, we found out how bad our health insurance coverage really was. It wasn't that we were denied care. We got care. We'll never know if we got the same care that we would have gotten had we had another insurance plan. We got care most of the time, but we ended up with these humongous bills on top of it. Even doctors that weren't covered by our plan, that actually slipped into a surgery somewhere and provided part of a procedure or read part of a test, and a bill came in from that person. Or parts of our insurance that didn't cover all of our out-of-pocket expenses. If you've ever read your insurance policy, you'll face things like we saw. Our maximum out-of-pocket exposure every year had swelled to $9,000, meaning that that's what our insurance company said we could be responsible for on an annual basis. Larry got sick one year in 2004 in December, racked up that $9,000 maximum out-of-pocket exposure. Calendar year tips over, and guess what happens with your bennies? You know what happens. The clock resets. You can start owing money right away again. And guess who the most aggressive collectors on this planet are, for the most part? Hospitals, healthcare providers, doctors. It's a huge industry. For those of you, most of you know that. So in the midst of your big healthcare crisis, you're racking up debt, you're borrowing. Middle-class families, we do what we have to do to hang on, don't we? I took on extra work writing. My husband took on extra work delivering pizzas, this proud, tough man that works so hard to provide for his families, delivering pizzas, doing whatever you have to do to hang on, clawing to hang on. We eventually sold our house before we would have lost it, but only netted $8,000 out of the house sale. So that doesn't carry you very far when you only net out $8,000. You borrow from family and friends to the point where if you call a family or a family member or a friend and they hear your voice, their tone of voice changes. Because they're not sure if you're calling to borrow money again. Sometimes you are. All this time, cancer and heart disease going on, spewing in the background. And I was sitting in my office one day at the Black Hills Pioneer, where I was proudly the newspaper editor, the longest publishing newspaper in western South Dakota. We published Wild Bill Hickok's death on the front page of that newspaper on August 2nd, 1876, and I was very proud of my part in that journalistic effort. And a process server came to the front desk with garnishment papers for me. When I got over my humiliation over being served garnishment papers at my office, I was the editor of a newspaper. You don't do that. And I was taught to my core that you pay your bills. You stay responsible in this life. You do what you have to do. I quickly then had to do all the calculations to how do I keep Larry alive? How do I keep this ship afloat? If they garnish my wages and take that percentage of my money, can I, number one, pay my health insurance bill, pay the rent, and buy his meds? And the answer was no. And the only way to stop that garnishment was, guess what? Bankruptcy. So I tell people by that time, a $600 debt sunk our ship. And you all probably think, or maybe you're learning now, you think it can't happen to you if you're careful enough and you manage well enough. I promise that's what happened. That was Larry and Donna's story. So hence enters a friend of mine who called me and said Michael Moore was working on a movie, and I